Infertility remains a major public health concern in Ghana, affecting many couples and often leading to emotional distress and social stigma. Experts say the issue deepens the pain of those struggling with the condition. To deal with the situation, the Fertility Society of Ghana, FERSOG, made up of health and allied health professionals, has held its annual general meeting in Accra under the theme Reducing the Burden of Infertility in Ghana, Prevention, Fertility Awareness and Preservation. In an interview with the media, Secretary of the Society, Dr. Paddy Ayete, emphasized the importance of early detection and treatment, noting that couples who seek medical attention promptly have higher chances of success.
Fertility treatment is one of the conditions that the earlier you see a specialist, the better. And the earlier you get treatment, the better. So it will be our preference that if you came and you were seen by a doctor and you say you have infertility issues, immediately basic investigation should be done to try and find out where the problem is coming from. And once that happens, if they can manage it, they manage it at that level. If not, they move it on to the next specialty level to be able to handle it accordingly. For some people, within a month, you can do a full evaluation and know exactly where the problem is and know at what level it needs to be managed if you understand the subject. The delay costs us a lot of trouble. Mainly because a woman loses about 1,000 eggs every month. A woman does not get any new eggs. A woman's peak fertility is from about 18 to about 28. And once she passes 28, her fertility starts dropping significantly. It actually starts dropping from 18. So from 18 years, you are losing eggs every single month. And by the time you hit 35, essentially most of the eggs are gone.
Dr. Ayete also called for an end to infertility stigma, urging the society to show understanding and compassion.
The challenges in our society is stigma. And people seem to think that because you don't have a child or you haven't given birth to a child or you haven't gone to labor ward before, there's something wrong with you, you are incomplete as a human being. I heard today, much to my surprise, that your name is removed from the ancestors when they are mentioning people just because you didn't have a child. I think that is most unfortunate, but to avoid that kind of situation for most people, if people had, first of all, health-preserving habits, that would ensure that their reproductive health is protected as much as possible, preventing infections, maintaining a good weight, trying to be healthy, seeking interventions pretty early if they recognize the fact that their childbearing is taking a long time. It would ensure that they would have quicker service, cheaper service, and they'll be less likely to require the more expensive services. That removes them from the pool of people who will be subject to stigmatization.
Addressing the gathering, the board chair of the Kolebu Teaching Hospital and Member of Parliament MP for the Lambuse constituency, Professor Dr. Titus Kofi Bayu, called for stronger national attention to fertility challenges. He also lamented the lack of insurance coverage for fertility care, describing it as unfair and discriminatory.
Our health system is grappling with this challenge, but the reality is that infertility treatment is often limited and inaccessible. In fact, when I heard them mention the government has left the infertile or couples with fertility challenges and you, the practitioners, to your own fate. And I said, it's not only NHIS, even private insurance. A lot of them, once fertility is mentioned as part of the diagnosis, you are excluded. And so we have a lot of work to do to convince everybody that this is not something that people have had all that they want and now want to try something. It is a basic right. We have to convince the whole world to believe that. You can understand from our historical background why government was not focusing on fertility, because we're trying to manage the population.